We are here today to celebrate the International Safe Abortion Day. Yes, abortion has a lot of contentions in our country, but we are here to help each other understand the dynamics surrounding safe abortion and what the key stakeholders have to say about it. Before we start having the panel discussion, I'm going to allow my panelists to give a brief introduction of who they are and what they do, such that we familiarize ourselves to who we are interacting with today. Thank you.
Okay. Fellow discussants and the members around, allow me to salute you. And the salutation ever. Assalamu alaikum wa rahmatullahi wa barakatuh. And since we're not of the same denomination, allow me to say God is good. All the time God is good, and that is nature. My name is Mansour Latif Koroga. I'm a teacher at Timbogo High School, Kawempe.
Basebo ne banyabo muje bareko. My name is Lilian Nuwabine. Ndi muzalisa oba mukugu mu by'okuzaalisa. I'm a midwife and a women's health specialist. Sanyusa okubalaba ku mwenna.
Mbalamusizza nnyo bassebo ne bannyabo. Nze Sserumaga Mungi Stephen bimugwana. Ekiti kye ndimu wano ng'atwala ebyobulamu mu gavumenti ya Ssaabasajja Kabaka ebbendobendo ly'e Kawempe. Avunaanyizibwa ku byobulamu mu gavumenti ya Ssaabasajja Kabaka ebbendobendo lino erya Kawempe. Sanyuse nnyo okubalaba.
All protocol observed. Good morning, ladies and gentlemen. My name is Roger Swandera. I work with KCCA, Kawempe Division, in the Department of Public Health and Environment. I am mainly a data specialist. That's my area of specialization. But I support different activities in the division, among which is maternal child and health. Thank you.
Good morning, ladies and gentlemen. I am Assistant Superintendent of Police Mutera Simu. I'm the Division of Community Liaison Officer.
You're all welcome, your different dignitaries. Thank you for making it here today. And as we kick off our day and our discussion, our theme this year is abortion solidarity. And the sub-theme that we are having today is enhancing solidarity among coherent grassroots abortion rights advocates. Okay? So a brief preamble about the subject theme that we have today is we have a lot of maternal death as a country. And on account of the statistics that we are having as a nation, Uganda is among those countries that are having a very big burden for maternal death, because we are recording 336,000 per 100,000, and out of the 418 pregnancies we get in a year as a nation, we are having 25% of them end in unsafe abortion. And when we look at how much the government of Uganda is investing in post-abortion care, it is quite a lot of money. The government is investing over 13 billion US dollars in post-abortion care. And on account of all that is going on around us, we are here today to understand what is going on. How can we join hands and have the solidarity to fight against the unsafe abortions? How can we join hands to understand and go through the dynamics as a nation such that we reduce the national burden that is related to unsafe abortion and maternal death? So let me start with, we are having a panel of different dignitaries in different fields, and all of them have a role they play when it comes to policy. They have a role to play when it comes to awareness. They have a role to play when it comes to a woman and reducing the maternal death that we have as a nation. We have a few questions of discussion, but before I go any further, let me talk to one of the healthcare providers we have on the panel, and that is our midwife, a woman specialist, Lillian. Lillian, what are the significant challenges that you encounter in providing post-abortion care or CAC? And is it okay to prioritize a patient's mental and physical well-being in that service delivery?
Thank you very much, Madam Moderator. One thing that I can say is that when we look at health, health is not just the physical well-being of someone, but health, it is the physical, social, psychological, emotional, and the well-being of a person, and not merely the absence of the disease. So when us as health workers, we are handling a patient, we just don't consider the physical component, but how is that person psychologically? How are they emotionally? How are they socially, financially, and very many others? So, as you are all aware that abortion is a context, it is a complex topic, very controversial. In fact, when someone sees me like right now talking about abortion, they will say abomination. It's a taboo. How can you come out and even talk about the word abortion? In church, we would say, we rebuke that in the mighty name of Jesus. Yeah? That's what some of the church people would say. I mean, how do you come out and talk about abortion? So looking at, for example, the religious component, how the religious people view or think about the word abortion. Looking at the cultural, component, how they view about abortion. Looking at even the community, how it views about the word abortion. It is still a controversial issue. It is still a very complex issue. So now let's come to us as health workers. When you as a health worker, you are most of our training basically involves on what we call post-abortion care. And post-abortion care, it means that you're able to terminate you're able to, for example, someone comes, a girl or a woman, after the pregnancy has gotten a problem and maybe it's coming out like a miscarriage. And so you as a health worker, your role is to complete that. That's what I can say. So our training majorly focuses on that. But also in our training as healthcare providers, we also train that for example, you can provide this service of abortion care to someone or to a woman. You may be pregnant, but when they look at the risk of you remaining with the pregnancy, it is greater than the termination of the pregnancy. That if, for example, you remain with this pregnancy, maybe you have very high blood pressure, maybe you have sickle cell disease, or you have any other serious diseases, if you remain with this pregnancy, it can lead to death. So there you're like, what? The law accepts us to go ahead and terminate the pregnancy of this lady or this woman or this girl. So But the law, when it comes to abortion, it's very restrictive, as you have seen. The law does not come out clearly to really openly say conduct abortion, unless on those conditions. Either the risk of remaining with the pregnancy outweighs the one for terminating the pregnancy, or maybe you probably got a complication, and we are saying go ahead and provide post-abortion care, the care that is provided after that. So while as health workers we are providing this service, the challenge that we get is stigma from the community. That is a very big challenge. You'll find that if you're a healthcare worker and you're providing abortion care services, whether it is during, whether it is after, the community will actually stigmatize you. It will discriminate you. They will give you names like a killer, you're a murderer, such kind of names. So stigma affects us so much. But also another challenge that we get is from stakeholders, and I'll give the example. For example, the police will come in sometimes once in a while, and actually you can be taken to jail. By the time that you come in to explain to why you conducted the abortion, you're already in Rizira, if not Chitaria, and that is why you're explaining why you conducted that abortion. The police will come in due to very many reasons. You know, some girls come in here and there. Even when you're providing post-abortion care that the law accepts, but the fact that maybe the parents have gotten to know of that child, of that girl, and they involve the police, they will come for you and take you to Luzira or to jail or Chitaria or Narufenya. By the time you come in to explain, you're already inside the cells. So that is also a very big challenge to us. Thank you very much.
Thank you, Lillian, for giving an elaborative. Thank you, Lillian, for giving an elaborative on the challenges the healthcare providers are getting. Let me talk to the law enforcement officer, ASP Mutera. How do you balance law enforcement related to the abortion with the need to protect and support individuals seeking sexual reproductive health and rights? How are you striking a balance between a need of a woman or a teenager seeking PAC and the law? How are you doing it, sir?
Thank you, Madam Moderator. On the perspective of the law, there is an imbalance.
There is an imbalance?
There is an imbalance. Why? As per the Ugandan law and the Constitution, the Penal Code, it criminalizes abortion. However, the first president did state, there are some exceptions where abortion can be permitted. And those exceptions are only 4. That's according to the Health Sector Strategic Plan of 2016-2020. 1, saving the life of the mother at risk. That should this pregnant woman bears the pregnancy, in the long run, the pregnancy would cost her life. That's an exception. Number 2, in cases of rape, in other words, you did not at any one point wish to conceive with the person whom you had sexual intercourse with. It was against your wish, so you were raped. 3, incest. Incest is having sex with a relative, maybe an uncle, an auntie, a brother. Those incidences are always there. Then lastly, on the fetal impairment. In other words, according maybe to the scans performed, this fetus has impairments. In other words, the fetus is not in their abnormalities, of which in the long run it may either cost the life of the mother or cost the fetus itself, because it's abnormal. Now, for us as law enforcement, when people are doing abortion, we don't know under what circumstances have they best to perform abortion. That's now I want to come to why there is an imbalance, because you are asking about the balance. For us, the report we shall get is that this health facility, this medic, this lady so and so, this gentleman so and so has performed abortion. It has already taken place. So by the time we come in, it means we are not going to know whether this pregnancy was endangering the life of the mother. We may not know whether this fetus had an abnormalities. We do not know whether it was. So, in other words, by the time the circumstances under why the abortion was performed, the abortion will have taken effect. And for us as a law enforcement, we have to come in to enforce the law, because that's our role. Implementation or putting into practice what the law states. So, these specific permissions to abortion, I think we need to know who is supposed to okay for an abortion to take place, who permits, who determines that it was endangering your life, who determines that there were abnormalities and these abnormalities would cost you. For incest and rape, it is understandable because they are known. But even before you abort, maybe these culprits, the culprit of incest, the culprit of rape, should be inside, should be apprehended. Then we know that now we have really ascertained this lady was raped, the pregnancy was as a result of incest. Then now an abortion can take place. But if we don't establish that and we are tipped off that abortion has taken effect, we cannot sit. We have to come in. So that's why I wanted to arrive to the conclusion that there is no balance. There is a very, very big imbalance between the performers of abortion and the law enforcement. I think, have I brought out what you wanted?
Thank you very much.
You're welcome.
Thank you very much.
Good morning, everyone, or good afternoon.
It's already still morning.
By the names of Nadrina Rona,
I work with the Child and Family Protection Department, Kawempe Police Station. Our fund has highlighted on the abortion issues, but one thing that is going to remain in our head is confusing us. It's about the person who is responsible to carry out the abortion. Because we have so many mushrooming clinics, and we even have health centers around. But who is supposed to do the legal abortion? The person who is supposed to do that is a licensed medical personnel. So I want you to get that one clearly, and it should be your take home. Thank you.
Thank you very much. Thank you very much for the highlights regarding the law imbalance and how we are going to struggle as a nation to harmonize the law imbalance, because the theme of discussion today is around us. We are living with it. And as our theme states, abortion solidarity, we need to join hands and harmonize some of those things. Let me talk to our culture leader. How do you balance individual consequences related to abortion with the community expectations?
Thank you so much. As I introduce myself, I can reintroduce myself. Serumaga Monji Stephen Bimogwana is the name, representing Uganda government as the Minister for Health for Kawempe Division. First of all, Uganda government follows the national laws which restricts abortion, but the laws allows abortion on after a recommendation of a medical personnel. As Uganda government, we are so much into sexual and reproductive health issues. That's why we have programs of Ichoto, where we have the so-called singers and the so-called kojas who are supposed to talk to the young people, the adolescents, on how they have to go through their lifestyle in terms of protecting themselves, not to indulge into early sex, early marriage, and make sure that there is a reduction in teenage pregnancy. So the Uganda government promotes this, and we have that program, the Choto program, which is moving around in schools, in high institutions of learning, in communities, where we call on young people to come and they are talked to. However, as Uganda government, we can't say that abortion is not taking place, because when you look at the statistics, it contributes almost 28% to maternal mortality. So abortion is being carried out, but it is carried out indoor, whereby one, there is no permission, two, they have not talked to anyone that this is what we want to do. So they have not sought permission to carry it out. And the consequences are enormous. The consequences are many, but as Uganda government, because as we have said, it is common in our communities, Uganda government supports young people to go for sexual and reproductive health services. These services are many, but our emphasis is one, on young people acquiring knowledge. Two, we too promote family planning. That why should you indulge yourself in sexual intercourse when you don't know the repercussions? So when they know the repercussions, then it will be easier for them to use family planning for their protection. Because when you go out for an open sexual intercourse, definitely you should know the consequences. One could be getting pregnant, two could be HIV and STIs or STDs. So when you know this, it's better that you either use a condom, and you can also, because it's dual, it serves double purposes, then you can either use other family planning methods so that you protect getting pregnant, which is unwanted. Because for so many cases, most of the people who go for abortion are those people who have got pregnant and it is unintended, unwanted, and they find that, wow, I'm still a student, I'm not married. It's going to be a curse because in our community, as society takes it, when a young girl gets pregnant when she's not married, it is an abomination. It's a taboo. There is that society stigma. Why you at this age when you are not ready? So most young people fear that societal stigma. So at the end result is to carry out an abortion. And when they are carrying out this abortion, they do it with quack service providers, and the end results sometimes are not good, which sometimes lead to infertility. So as Buganda government, we strongly don't support abortion as per the laws of the country, but we support sexual reproductive health services, which includes family planning and knowledge acquisition, but we also support post-abortion care services, because we can't see someone who is rotting and because she carried out an abortion and we say, since she carried out an abortion, let her suffer. No. We support that person so that that person can get services, treated, and she normalizes. So we support post-abortion care services. So to society, as I'm ending, to society or to the community, really what we are doing is community sensitization, whereby we are urging parents to go back to their root, to come back to normal. Because to us as we are growing, it was the responsibility of our parents to guide us doing the parenting role. And you know, there were very limited cases of abortions as we are growing, which is not the case now, because every parent now is busy doing his or her own role, not considering the issue of guidance and parenting. At the end of it, we are losing the future generation because of the so many other causes. So I beg to submit. Thank you so much.
Thank you very much, Mr. Monji, for that feedback you have given. The questions, I'm going to open them later. Apologies. Mr. Monji, I'm still talking to you, please. Can abortion be morally justifiable in the Buganda context?
Or in the Buganda government, I cannot say that abortion can be morally justifiable. Because when you look at morals of Buganda government, one of the things we are promoting is virginity. So, an institution which promotes virginity cannot say that abortion can be morally justifiable. What we are looking for is to see every young girl getting married when she still has her virginity. So that's what we are looking at. But looking at other factors, there are other factors which may lead these young people to have issues of engaging themselves into sexual acts. As my colleague Afande Mutera was saying, if that person is maybe raped, we have these relatives who would be the source of moral development, but now they are the source of moral decay. Some, you take your daughter to the uncle, then 2-3 days down the road, they say the uncle has used her daughter. We have even seen fathers using their own children. So that is not moral. But for us as Buganda government, we promote morals. And in Buganda government, abortion is not morally justified. And we can't say that we can add a value to abortion in Buganda government. No. That's what I can say.
Thank you very much, Mr. Monji. We have all understood the cultural context of the theme of discussion on basis of Buganda government. I would like to get the religious view and perception in regard to abortion, especially from our brothers, the Muslims.
Thank you, moderator. Allow me to thank the past the presentations. To us, in Islam, Islam condemns abortion. Completely condemns abortion. Because for us we believe that is a soul that you are terminating. It is a soul that you are terminating. So there is no way Islam can say that abortion now it is okay and it is legal. However, there are some situations that Islam permits. One, as regarding to safeguard the mother. Actually, Islam values the life of the mother more than that life of the fetus. If the fetus is a problem to the mother herself, and it can lead to death of the mother, we can't lose the mother when we are guarding the fetus that even don't know how it will look like. So we give the priority to the mother's life. That is, if on condition sikubeera eri waka mu nyumba ne musalawo mu tata ne maama tono mwana tumukole ki lwansonga nti wakamala okuzaala omwana awezeza emyezi ebiri. It has to be medically justified. If the medical doctors justify that, according to what we see, for example, there is ladies abatafuna normal delivery. Yakamala okuzaala, she had some complications in the womb. She has experienced what you call it a C-section. And now, just in 1 month, she's again pregnant. When the doctors come out and they see that this woman cannot handle the pregnancy, and if we say like, let her be with the pregnancy, we are putting her life in danger, then Islam comes out and say we can do the abortion. However, it has to be safe, not from inside the doors, not from these clinics that we always have. It has to be a safe, with a justified, clear health document from professionals that no, I know. So, when it regards to abortion, there are some scholars that even say whether it is incest, whether it is rape, abortion is not allowed. Whether it is incest, whether it is rape, abortion is not allowed. And we sit down and look. This is the daughter, and the owner of the pregnancy is the father. Now the baby agenda kuita ashoma. Just mumberezachi. So then we can reach to an understanding, an agreement with the law enforcement officers. Let us safeguard the pride of this young soul. Because the daughter or the son she has, the owner is the father. So chigenda traumatizing the whole life. So there we sit and we agree either on termination or non-termination. Thank you very much.
Thank you very much, Shay, for elaborating on that. And I believe all of us here are learning something new. When we look at post-abortion care as one of the services being provided by a healthcare provider under the granted terms according to the law, how do you address concerns and fears surrounding abortion, especially for the teenage pregnancies that may seek abortion?
Okay, thank you very much. Now we are talking of circumstance, abortion has already been made. Either safe or unsafe. Everyone has a right to medical attention. Everyone has a right to medical attention. Even the things that we always see being practiced on mob justice, they have a right to medical attention. They have a right to medical attention. Now look at this innocent soul. The owner of the pregnancy, this happened in school, young teenagers indulging in sexual intercourse, and again they resort to abortion. We normally have them in schools. Nebagula amadagala nayagala akyekolereko wa mu dormitory. Yes, already amaze okikola. That's where we come in. Eriba n'abasawo nti now let us help. Ate to safeguard the life of this mother, young mother. Because I always tell them, because me I deal with girls. My school is completely girls' school. It's a single-sex school. I always tell them, if you get a problem, just be open and say it. Open and say it out. The only thing we have is the fear in the community. She talked of the stigma on their side. But even these girls, the fear from the community, that fear, that stigma, the community, she's a mother at 16 years, she's a mother at 15 years. We distance ourselves from them. As the parents and leaders and elders, we distance them. We distance ourselves from them. They decide on their own, and their decision 100% can't be right, because you never know. I might be in position to protect my child. I might be in position to take care of my girl till when she delivers. We've had some cases where parents come in, the girl has been raped, no termination, no abortion. Kazare, then after I'll take her back to school. And they're back in school with babies at home. Because when you distance yourself from them, it causes them to make fake and unsafe decisions. Kubaka, this is a teenager. The boy is 16, the girl is 15. What decisions are they going to come up with? That's the abortion. Inside the dormitory, now they call you, the girl is bleeding excessively, then you have to rush her to the hospital. Reaching to the hospital, nearby hospital, she has been carrying out abortion. So we should come close to our children, be it at home, in the community, only that these days children are not owned by communities. Parents own their children. But back in the age, we were owned by the community. You do something wrong, the community was responsible. And that's why we grew up. Therefore, if the girl has committed abortion, let us come in to Mubudebude, like counsel her, at them normal. We hope her access the medical attention. We call it PAC, because abortal care, it has to be there, because she's like someone who has given birth. Doctors will testify. Someone to abort, it's like you've given birth. Oh, that's a day. Because if you neglect this child, because of abortion without your consent, again now you're committing a grave sin, you're now causing death to another innocent soul. And when that girl dies in your hands, when you are aware, because you are very, very mad at blah, 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 such excuses, then for us this way, in the religion, the courts of the religion, so facing, and it is punishable by Allah, leading to the death of another innocent soul. However much she has done a mistake, let's get her access to the medical attention or medical care. Thank you.
Please pass on the microphone to Lillian. Lillian is an advocate of the teenagers, the woman, and every female being that there is regarding the theme and subject matter. Lillian, what do you have to say about that?
Thank you very much, Madam Moderator, and all the past presenters. Thank you for the good, presentations, the sharings. So from my side, what I can say that as a midwife or even as a healthcare provider, our services we are actually non-judgmental. For example, an adolescent has come and they have aborted. Our role is to provide post-abortion care. So we are non-judgmental. Tetugenda kutandika ntona alina empisa embi abadde yeetwala ali mu basajja tamanyi kyayagala ne tutandika like kumuloopa, such kind of things. No, we are non-judgmental, and our calling is to be able to help out this girl by providing the care that this girl requires. Saving a life is what is most important. But after that, what we do as healthcare providers, kale kituuseeko tumuyambye. But is it not going to happen again? So now we provide education or sensitization to this girl. Until next time, to be able to avoid such kind of things, maybe you need to use family planning or contraceptives or contraception. So omwana, we shall take them through that kind of education, and they can be able to use one of the best family planning methods, so that next time it doesn't happen. Next time, in fact, she decides when to get pregnant and when not to get pregnant. That is our role. But also, when such a girl comes to our side, we know that on top of providing the medical care, psychologically this girl is not okay. So we need to be able to psychologically support this girl, and that's what we do as healthcare workers. Emotionally, we also understand that this girl is not okay, or these girls are not okay. So we emotionally support them. Socially, we also understand that, as the colleagues have said, this kind of girl will be discriminated, will be called, a murderer, will be called, a killer, will be given all sorts of names. So socially, we try to see how to support such kind of people, so that they can be accepted by the community, so that they can go back and, return to school and be able to have a brighter future. So as healthcare workers, we are non-judgmental, we are very open-minded, we are ready to support these kind of girls. Thank you very much.
Thank you very much. Thank you very much, Musao Lilian. Mr. Rogers had something to say.
Thank you so much. I want to respond to this in relation to my colleagues. To just put this into perspective, as of today, we have had over 1,000 children who are pregnant. Over 1,000 children. I use the word children intentionally. Who are pregnant. Then we have also had over 1,000 that have already delivered. As of that's by around August. The year has not yet ended. We still have some good months to go, but you can see those numbers. One of the key things that the healthcare system has put in place, we are trying to encourage our community members to create safe spaces. Creating safe spaces within the community. We realize that majority of our young girls and boys, I was somewhere a few days ago and somebody was saying we are putting a lot of focus on the girls. What is happening to the boys? Are they not the ones? Are we not spoiling the boys who are going to make our girls lose hope? So we are really encouraging safe spaces within the community to ensure that we have as many young children or girls having access to their preferred choices of services that they need. Most of these girls, by the way, one of the experience that I have is that many of them do the things within the community before they even reach the facilities. Most of the abortion care issues happen in the community. What we do at facility is possibly post-abortion care. Okay? As of August this year, Kawempe alone contributed 56% to the post-abortion care services in the whole Kampala. 56%. The highest, I think the next is around the 17%. That's Nakawa. So you realize that the need of our community is not the usual community that we find in other areas. We have almost the highest number of slums, which are key driver, because slums are normally a driving force to some of those unjustifiable circumstances. Two, I think we also have, the nature of our community, I think the access to some of the basic services in our community is also lacking. Okay? Now, well, I think someone will, we had a scenario one time, National Fund is just here. But one of the girls died in a small health facility, just up here. A very small health facility, almost 100 meters away from Kaenda National Fund. Then you asking this woman, why wouldn't you send this girl to Kaenda? Because just a few meters away. So the nature of our community is in such that many of them don't feel, maybe the access is poor, perhaps we can attribute that to the poor access. But then you cannot tell me that almost in every parish in the division, we have a facility that's either doing deliveries, that's either offering family planning. Perhaps the nature of our population is also, the economic aspect is also a bit poor. Somebody will say, for me to go to a facility in Wise, perhaps I need some little money, which this younger girl may not have. So we are looking at quite a number of factors, but let's also be mindful of what is happening in the community. And I want to assure this audience that majority of the abortion cases are happening in the community. What is happening in our facilities is simply, and our teams, when you go to Komamboga now, the facility I'm very familiar with, we have a very good youth corner with a very serious qualified, actually he's even a man. When you reach there, what is happening there, you will really appreciate the quality of what's happening there. But we're also encouraging the private healthcare providers. And this is, to me, where the biggest problem is. Afande told you that, I think it was Afande, the Afande, who said, the report should come from a qualified health personnel. The question is, how many do we have in this country? How many do we have in Kawempe? It is only in Kawempe where I've seen where a facility will open at 6 as you are going home. You find it open. During the day, it's a show. And this is where people are going. This is why is it here? No, that's the truth. You will go to a facility. I want some of you to take to move around here. You will find during the day you find it a shop. In the evening, as you are going home, it's a facility. I'm very busy. So we are also saying, can we have designated sites where some of these cases can be handled? Can we have it happening at Kaimpe National Referral? Can we have it happening in Komamboga? Can we have it happening perhaps at Abi? And can we also have, if at all a fee is being charged, can it be subsidized? So we are looking at issues around economic empowerment, we are looking at issues around community mobilization, and the quality, the skills of our healthcare providers to offer, especially for abortion care. Thank you.
Thank you, Mr. Rogers. Before you pass on the microphone, I would like to ask, how ready or prepared is the health system in position to handle the big 56% post-abortion care in Kawempe Division?
Thank you. How are we prepared? We are prepared in a number of aspects, but our preparation is based on the 5 key driving force behind the health sector. The health sector is being led on 5 key principles. One of which is community sensitization and empowerment. One of the things I've already mentioned, I've told you, we have a fully fledged youth corner. I think I'm not yet sure about the international referral, whether it also has that youth-friendly corner, but at least we have one in Komamboga that's fully functional. And we have also made it a habit that youth services in every facility should not be only a concern of the youth-friendly corners. It must start from the gate. You know, let me tell you one of the experiences that I have. Our younger people, when they go to our facilities, first of all, they start by hiding around. Somebody reaches because he wants to get a family planning method or testing for HIV. We not go directly to the HIV clinic. He first start there for like 10 minutes. Then, if they consult with garage, and you know, it takes her so much to even air out. So we are saying, can we have our healthcare system getting giving information to these people right from the gate. Can we have an askari saying, okay, Mwara, Mlezoze, how do we help you? Okay? And in a very good way. Can we support integration right from the community to the facility? Right now, as a division, we have given out mobile phones to our VHTs in the community. And what I think we are encouraging them to do is, can we have them activate their referral mechanisms? Referral mechanisms using now the online system. We are going digital, using the digital system. So that if I refer this young girl from where you say to Kayempe National Referral to Komamboga, am I able to follow up and see that this person actually reached and got a service? So digitalization, we have done that already. We have ensured that we train our healthcare providers, especially in post-abortion care, because we have realized with these numbers you can't just sit and look on and yet people are dying. I didn't even tell you how many we have lost. We have so much that when I read the statistics, some of you will go with a very different mind. We have so much. In 2020 alone, we lost close to 15 younger people, 15 who had done abortion. 2020. Good enough. The beauty is those numbers have gone on reducing. When I went to one of the facilities, I will not mention the name, and we were discussing issues to do with the post-abortion care. It's a Catholic facility. And then they told me, this don't even talk about it. Father, so, and this, we are also trying now to ensure that right now we are working with some of the Muslim leaders. Sheikh Mwanje, I hope you know him, who is very instrumental now. He's always outside there meeting young girls and boys, preaching the gospel about safe spaces, safe living, okay, the quality of life that they need. The other thing is that we have tried to promote a lot of private partner collaborations. That's why I'm here. We have now Coherinet on board, fully. We have TICO. I think some of you have heard about TICO, and so much into younger people. We have had so many. I may not mention all of them, but all of them now we are looking at the younger people. Now, one of the key things we are trying to mobilize is, can we have targeted, focused outreaches for the younger people? Can we have targeted, focused outreaches for targeting younger people? With so many HIV testing, cervical cancer screening, they need these services. Don't discriminate and say now because we have, we are not now going to only look at family planning. We are not only going to look at post-abortion care. We are offering a wide range of services to our people. Thank you.
Thank you, Mr. Roger. To all of us that are seated at the panel, how can we address stigma? Because we have stigma at different levels. We have it at community level, we have it at individual level, we have abortion stigma at national level. At the different levels, there is a lot of abortion stigma. How do you think we can address abortion stigma?
Thank you so much, Madam Moderator. Allow me first use 1 minute before I talk about how we can address stigma. And, what I want to say, I'm getting it from a colleague who is seated next to me, and I'm also pulling it out from a study I've just concluded on determinants of utilization of youth-friendly sexual and reproductive health services in KCCA health facilities. I've done that study, and I've just concluded that study. It is challenging if we could give a place like Kawempe, where a colleague has mentioned it very well, that where we have friendly services is Komamboga. And I agree with him. Think of a young person who wants to get a service. She doesn't know, or he doesn't know what he's going to eat as lunch or supper, but want that person to live where he say to get a service in Komamboga. Leave Kalere get a service in Omamboga. The cost alone of accessing that service is beyond his or her control. That was one of the findings. 2, attitudes of these health workers. I can give you an example. I went to one of the facilities I'm not going to mention. Midwife came very late, around 10 a.m. with her kids and like a small bag, the way they walk. So before she even entered the office, she looked at the ladies who had come for ANC. Then there was a young girl, 15 to 16. Then started, even before he even said good morning to those people who were there. You, at this age, yes, she was telling the young girl, you, at this age, do you see anyone of your size in this? How dare you are seated in these mothers? Don't you think you don't fit here? Before she even listened to her. Then, the attitude of health workers is also another contributing factor. And that was not the issue. But I want to show you what is happening outside there. So as we are looking at stigma, there are so many promoters of stigma to these young people. So many promoters of stigma to these young people. As we are looking at the values, the norms of society promoting, but there are also other promoters. Think of their partners. They come to them, you know, even if, before they even mention the word pregnant, they are chased away. You pregnant? Me on a Friday, we don't make pregnant. You know those challenges, you have them in young people. So if you look at those challenges, that is stigma number 1 from the partner. How can we convince the partners to know that if they have made someone pregnant, it is their responsibility? Because it's stigma. When I come to you and you say, it is not my responsibility, I'm not the one, yet I know you're the one I've been moving out with. So that alone, it is stigma. So to me, the only way we can fight stigma is to carry out regular community sensitization. He has talked about it, that they have a team of PhDs, they have, he has mentioned Sheka Mwanje, but that one alone in quotes, Sheka Mwanje, is he friendly to the young people? Is he the person who can approach the young people? Where are the peer educators who are educated and have got knowledge and they can reach out to the fellow young ones? So I think what we need to do is to have different cadres doing different roles in the community, and we need to promote community sensitization. So as we create awareness, we can reduce stigma in the community. At the same time, not reducing stigma, but when someone is aware of the repercussion or the dangers of what they are doing, definitely also do what? To also reduce. That's what I can say.
Thank you, our representative from Uganda Kingdom. He has given us a preamble and feedback on the attitude of healthcare providers, stigmatizing these adolescent mothers or mothers to be. Sister Lillian, what do you have to say about that?
Okay, thank you very much, Madam Moderator. And I appreciate the representative from the Uganda Kingdom on that submission. It is not new for actually the community to say that as healthcare workers, we have a bad attitude. It is not something that is new. But while I am it is known. Oh, it is known. Okay, interesting. It is normal. So I appreciate all those submissions, and as a midwife, as a healthcare provider, I accept and acknowledge that. But at the same time, I can say I'm an educator. You can call me a teacher, you can call me a trainer, and very many others. So some of the things that we are trying to handle as healthcare workers is to be able to work on the attitude, our attitude as healthcare workers, because we believe that the attitude is a game changer. Once as a healthcare worker, you have a very positive attitude, you have a very good attitude, then it is a game changer. Things are going to change. Things are not going to be the same. The adolescents we are talking about who are pregnant and would like to seek, sexual reproductive health services from us, they will indeed come to us. So I do acknowledge on behalf of my colleagues, the fellow midwives, the fellow health workers, that our attitude is bad, but I can promise you, that it is something. I am going to, once again, I accept that on behalf of my colleagues, that as a midwife or as midwives or as healthcare providers, I do acknowledge, just like you have all said, on behalf of the community, that our attitude is not good. So I acknowledge that. But I can promise you that it is something that we are working on. And that's why I say I'm not just a midwife, but I'm also an advocate. I am a trainer. I am an educator. I am a facilitator. And one of the things that we are working on is the change of our attitudes as healthcare workers. Because that's why some of our colleagues here have said that actually these adolescent girls do not come to health facilities or our hospitals because they fear us, the healthcare workers, who are not approachable, who are not good to them, who have a bad attitude. So it is something that we are working on, because when our attitude is good, then everything shall be okay. So please, on behalf of my colleagues, we do really apologize, but I can promise you that we are working on that, and a new breed or a new brand of the upcoming healthcare providers, whether the nurses, whether the midwives, whether the doctors, it is going to be different. I can promise that. That the way we handle you, the way we speak to you, the way we communicate to you, the way we work with you is going to change. Trust me. I do really understand the challenges, and I can hear from you, the community, saying that but it is something that we are working on, and I can assure you that in this 21st century, the coming years, we are going to be a different, brand of healthcare workers. We promise to be approachable. We promise to be, reliable. We promise to provide the best healthcare services to you, and we promise to love you. Thank you.
Yes, before I really open it up, it's getting hotter, but that is a pledge or a commitment from a national trainer. She's not speaking as Lillian, but she is a national teacher, a national trainer. And we do believe, with all the commitment she has made to this audience, we shall see change in attitude of our healthcare providers. Yes, Mr. Rogers.
Thank you so much. I want to begin by drawing attention to the issue of attitude. One of the most hectic, the most professional area that we have in this country or world over is health. And healthcare providers are governed by a strict code of conduct that governs them wherever they are, even in their homes, by the way. That code of conduct for a healthcare provider extends up to home. So what are we saying at policy level? We are saying issues around attitude. We only encourage a positive one as a health worker at all times, whether in the community or the facility. So what happened that day for that health worker was really regrettable, and it's not something that we can take for granted. We don't condone at any level issues around poor attitude, issues around communication, whether it may not only be to a younger girl, it may be to any healthcare provider. And we always say, whenever we have such cases happen in the community, one, we engage the healthcare provider in that situation, and we try to find out what could have gone wrong, to ensure that we don't have the similar issues happening again. But we are also telling the training institutions for the healthcare providers, and I think that's why she said there is a new breed of healthcare providers who are coming. We are also trying to engage these institutions. Please, one of the key things that I should focus on while training our healthcare providers is the issue of attitude. We don't want to see a healthcare provider, because you're dealing with somebody's life, and life is precious. And therefore, you must be in your best moods. You must be in your best. You must have everything around you should be the best. Then the issues around stigma. I also wanted to say something. One of the key, I participated in a study some years ago in northern Uganda, and around attitude issues in public health. And one of the things that we saw, one of the participants told us, actually the highest number of participants told us, I think there are some there are some groups of our community that are not doing enough. When a younger girl gets pregnant, let's not look at it like life has ended. Life has not ended there. This girl can have a future even after. Because we have had them. Even in our government right now, we have ministers who gave birth as early as 18. Right now we have them. I may not mention the names. We have some of them even in the current cabinet. So we are saying, can we have all stakeholders coming on board? If you're a father in a Catholic church, can you have a session, a smaller session, and talk about issues around the younger people? If you are a pastor, we can minimize issues around the tithe and offering. Can we have a few minutes to talk about issues around health, especially targeting younger people? If you are an imam, let's have all stakeholders. Let's not leave it for the partners only, but we can also have it in the community. 2, can we now take the Uganda Kingdom? I expected this to come from our cultural leaders. Can we take parenting to family level? Can we have singers doing their work? Can we have mothers doing their work? Fathers doing work? A father, one of the things I've learned as a father is that I think we do a lot of money, we go looking for money, and we forget that we have families, by the way. And then mothers, especially if you find a working class mother in the morning, you drop a kid to a kindergarten somewhere, and then you come back and pick at 9. Are we really? What kind of community are we raising? So for me, this should go back to the community. Let all stakeholders do their part. Yes, at healthcare service delivery point, we shall also do our part, and we pledge to do that. But let it begin from down here. Thank you.
Thank you very much, Mr. Roger. Let's hear from Haji.
Thank you very much. The issue about stigma. I think we should advocate for what our parents did to us. As I said earlier, the children were owned by the community, which is not the case as we speak right now. When you talk of where the stigma is coming from and who practices the stigma, these young teenagers are surrounded by these people. When you go to school, it is happening. When you come back to the village, it is happening. When you reach at home, the mother is also contributing on the stigmatizing of these young generations. Now the father, the only thing he knows is take out Zakameza. Now we have left these children, these young souls, okuberanga, they are raised up by the waves. We call them waves. No wonder according to the statistics, abortion is not done in the health centers. Just in corners, behind the doors. And when you look at these small health facilities that carry out abortion, they're even hidden. So they're hidden somewhere. No wonder these girls and boys who are victims, they even fear to go to the health centers of qualified personnel just because of the stigma. She's now pregnant. At school, I do say because she's what? Pregnant. I gave you an example of a girl. Not in my school, but a certain school, I will not mention the name. She got pregnant from school. The father of the pregnancy was in school also. What they resorted to is to buy some tabs. I don't know whether they sent the askari or whether these scholars, but they came up with tabs
The girl took, and at night, her life was in danger. Imagine at night. The boy is in the dormitory, the girl is in the dormitory. Now she's trying to take the pills to terminate the fetus, and there is no help at that time. So the stigma is causing what we are now advocating for, the safe abortion. We are not having safe abortion just because of stigma. Now parents and community leaders, stakeholders should come up with how to handle these innocent souls. They are innocent. A girl on her first time to have sex, she conceives. She knows nothing. She knows nothing. And even they take time to realize that they are pregnant. Let me give you an example of another girl. They were in the dormitory, girls talk. Then some of them told them, asked her, are you still a virgin? Yes, I'm a virgin. The girl is testifying. By the time she realized that she's pregnant, then she's testifying where it came from. Now when they went to the holidays, she had to get rid of this because even name group and she even went back to school. Then finally, the colleagues, the friends now start seeing her. Maybe you are pregnant. Those ways, better go to the nurse and ask her. When she went to the nurse and like, woman nurse, these girls are saying that I'm pregnant. Why do I look like a pregnant woman? Then the nurse said, let us test and see. And she was pregnant.
3 months, 4 months.
4
Yeah,
4
I know
months.
what happens now.
And she was pregnant. Just that group influence. And that's where our children are heading to. My children and your children. Because now, ewaka twafuka bakanga bana. When you enter the bedroom, the sitting room, all children go to the bedroom.
They give us names.
When you go to the bedroom, they all go to the kitchen. When you go to the kitchen, they all go out. You can never have your children just with you at home. Because every time you're quarreling, every time you're beating, every time. Now that, imagine such a young lady getting pregnant. She now starts reflecting back home. Her daddy. Her mommy. Even parents reach the level of even chasing them away. You go away with your pregnancy. Don't try the water. What will happen next is abortion. So we should eliminate what we call stigma. That's done. We should focus on how we can engage with her. Tumutegeze how to handle herself. Wabanga achisemo so that she cannot repeat the same mistake again. Whether in church, whether in the mosque, in community, we should all advocate for that. Thank you very much.
Thank you very much, Shay, for sharing life experiences where we cannot all run away as stakeholders. Back to the theme of the day, we are talking about abortion solidarity. How are we advocating for sexual reproductive health rights? How are we advocating for abortion as a right, safe abortion as a right? Given the restrictive policy and law that we have as a nation, what recommendations do we have, we as panelists? I'm going to start from the law enforcement officer. The law is very restrictive, and people that have conducted or performed unsafe abortion are hesitant to approach healthcare facilities to receive at least post-abortion care. What recommendations do you have as a...
Thank you, Madam Moderator. I want to first push us back. One of the panelists said that most abortions are done in unsafe places. Why? Because the safe places, the non-health facilities, they know it very well that to perform an abortion is illegal. once you are known and apprehended, the consequences are bitter, which may lead to the cancellation of your license. So, as we deep dig into this dialogue, whether safe or unsafe, is it legal? I think as stakeholders, and maybe let me push this to you, the NGOs, that as we are here, as we are as we dialogue, as we discuss on the safe or unsafe abortion, can we first go back and push legislation? Because no one will stand on their feet and say that I have performed abortion because of ABCD. Then, on the issue of stigmatization, it is true there is stigma. Why? Because once you do the undoable, of course, you become a wandering subject. If now I came dressed in a dress, people would be wondering, is this officer,
Okay.
is he okay? Is he normal? Because I have done what the public has perceived as abnormal. So the communities, even as we sit here, you receive a phone call now that maybe your son of around 16, 15 years has impregnated somebody's daughter, or your daughter is pregnant. The emotions now will change. Because even the parents, not even the victims, even the parents, you may not be victimized, but how? Of all children, how could my child, and maybe you could have put in very many restrictions. Your children are always in an enclosure. You are the one who takes them to the school. Every time and again, you are even a role model in the village or where you stay. But boom, your child is what? So even the stigma is not only on the victims, even us, the parents. It may even stretch from the parents even to the relatives. It may even stretch from the relative. It is a school, the whole school. Even right now, most of you know the best doctors who perform abortion. They are known. Why are they known?
Because they are the best.
So, I think we need to engage. Of course, me as a law enforcement officer, I may not engage, but we have stakeholders, the culture, the civil society, religious. You push for legislation. That as long as we don't have legislation, we are going to keep on working behind doors. That is the reality. Even now she's talking, but right now, if somebody brought that my daughter perform what, she will first feel nervous. Things. At the end of the day, you say, "Nae tobacco bogamba."
Thank you very much, Officer Mutera. Before Mr. Monji hands over the microphone, I have a burning question I want to give Mr. Monji. Being that he is representing the land where we are all seated. As Buganda Kingdom, given the statistics that Mr. Isabide has given, we have a high rate of unsafe abortion being done at community level. And if it is done at community level, it is done by maybe quacks, like you have said. We also have traditional birth attendants that are really pushing the unsafe. What recommendations can you give us, Mr. Monji?
Thank you so much, Madam Moderator. Policy-wise, we no longer have traditional birth attendants. Policy-wise.
Yes.
Hope you get me right.
Yes.
But someone can be doing it as a traditional birth attendant, but the law does not respect her and whatever she's doing, because some good years, government has abolished traditional birth attendants. And if governments come across any, those are cases to answer. So, as you have put it, that abortions are done in the community and they are anonymous. What is the take of the community? I think that's what you want to get. Did I get you right?
The take of the community is the burden. What are your recommendations?
Yes. What are the recommendations per se as Buganda government as far as abortion in the community is concerned? I want to give you a very small happening or history in regard to police. When I was growing up, I was everyone's child. They find me when I've not gone to school. Anyone could ask me, and I had to answer. They find me praying at the well, and I came to fetch water. Someone could even pick a stick and give me one too. I rush home. They find me doing something which is not normal. At a young age, standing with a man or a boy, we would answer questions. Personally, I was a victim as I was growing. I had my first sexual encounter in my senior 6 vacation. I was very stupid. That's what they used to say. But the day I did it, I was caught by the defense secretary. So the whole community came to know that I did it. And I said, these things are bad. Because they put me in front of the whole community, the LC1, and I was charged with the girl I did it with. Then I said, no, these things are not good. Community had responsibility over all children within and outside that community, which is not the case now. And this has happened because of the law, Child and Children's Rights. But they emphasize children's rights, they don't emphasize the child's responsibility. That is where the problem is. So if we want to see change, as he has put it, we have to make amendment in the children's rights. If we don't make amendments in the children's rights, where you find a child and like you blame them of the wrong thing they're doing, you slap one, you end up in cells. Definitely, little will change. But we need to fight for the amendment of the children's right, that the child becomes the responsibility of all the community. However, there are some people in the community who don't want to see other people's children growing up positively, but those are very few. So let's fight for the amendment of the law. When we do amendment of the law, you know, as Buganda government, for us we follow the bigger law. That is the constitution. However much we have policies as Buganda government, but what does the government say? So we are under what the government says. So we just come in just to implement most policies of the government which are in line with the norms and values of the Buganda what? Of the Buganda government. So if we are to do something in the community, children must be belonging to the whole community. So that calls for an amendment. Thank you.
Thank you very much, Mr. Munji, for that recommendation.
I beg to leave. Yeah.
Thank you for that recommendation, Mr. Munji. Before I get to Mr. Lilian, I humbly request the microphone go back to Mr. Isabile. Mr. Wandera, sorry. Given the fact that there are very many unsafe spaces in the community that are handling the unsafe abortions, as the health sector, do you have any recommendations on how to cut down that situation? Because when we look at our maternal death rate, it is quite high, and Kawempe as a division, I think we are skyrocketing. So do you have any recommendations that you can give?
Thank you so much. Before you go any further, by the way, I have my boss, the Minister for Health, so it's just good that I recognize her presence. She's in the house, so that's my boss. Before I delve into the question, allow me to take us back to some of the key things that I think we should discuss or talk about. One of the key things that we have noted in terms of healthcare, you know, at healthcare service level, we do much of curative, but we also have an aspect of preventive. We prevent something from happening, but we also offer a curative side. Now, what has been happening in the community? One of the key things, I think, before I go any further, let me say this, that first of all, who is in charge of these pregnancies that we are talking about, and of course subsequently that lead to abortions? Who is responsible?
With the community members.
It's actually the men.
The boy.
It's actually the men. Can we then therefore have targeted sessions for these men? We men who are here, by the way, we look very good during the time. We are very good men. You know, life changes. Life changes. We are very good when we are here discussing the things, but I'm telling you, life changes at some point. So, can we have men being brought on table? Okay?
Because they are the key. They are the biggest victims. Then too, I think parents have made digitalization and technology very normal. In that you wake up in the morning, you go to Dubai, you buy your daughter or son of 12 years a phone worth 2 million shillings. You and you even don't want to know what happens with this phone. What your child is using this phone for. The truth is, there's so much that happens on digital and mobile systems that we don't know. Apparently, we now have TikTok, where there is everything that you would wish to know is on TikTok. Okay, WhatsApp, everything, and I'm telling you, you will now find it is in this generation where you find a child as young as 10 years is already having a WhatsApp account, a Facebook account, a TikTok account. Then you now wonder what he or she is using it for. The truth is, digitalization has led to a lot of, unsafe abortions per se. Okay. Now back to the question. One thing I want to say is that as healthcare providers, we operate on a non-discriminatory policy. Non-discriminatory policy. Okay. For us, once you come wanting a service, we shall offer, so long as it's within the law.
We shall not terminate the pregnancy under normal circumstances unless those conditions prevail. But for post-abortion care, we are offering 100% success. We don't discriminate, and we are encouraging healthcare providers, kindly, if it's about post-abortion care, please offer those services without discriminating. Because it is actually, health is a universal, we have universal access. It's the only area where access is universal. Others, there are limitations. Ours is universal. So long as something is within the law. If you say, you go for example to Commemoration under normal circumstances, you say that they will tell you, our need. But if it is about offering post-abortion care, please, we encourage it, and we encourage our health. Please don't chase away. Don't let this mother, this woman, leave the facility to go and die in the community. Okay? When I bring you the statistics, perhaps to just put this into context, in 2024 alone with the last 8 months, we have had 1,200, almost over 1,200 incomplete abortions happening. And somebody was telling me these are just numbers at Ministry of Health level. So, and somebody told me this is just not even half of what is happening actually. Imagine 1,000 in 8 months, over 1,000. But it's just a few of what's happening in the community. So it's not something that we are taking lightly. We don't want a woman who came to the facility to seek a service, and then our health worker said, no, we are not offering that. Then goes back into the community, dies as a result of, incomplete abortion. That is not okay. And we are encouraging health workers for post-abortion care services, kindly, you offer. But for abortion, unless the law allows it, kindly. So the rights to abortion are limited, I should say. Thank you.
Thank you very much, Mr. Rogers. Given the statistics of over 1,200 incomplete abortions in just a period of 8 months, and one of the panelists said the unsafe is happening at community level. It's done by quacks and traditional birth attendants. Lillian, do you have any recommendation?
I'm going to beg your pardon one more time.
Do you have any recommendations on how we can deal with the actors of the unsafe abortion at community level?
Okay, thank you very much, Madam Moderator. Just as colleagues have said, that for example, for one to be able to provide, for example, post-abortion services, you must be licensed or registered. As healthcare providers, we have different councils that regulate the kind of work that we do or our practice. For example, for the nurses and midwives, we have what we call the Uganda Nurses and Midwives Council, which regulates our practice. For the medical doctors, they have what we call the Uganda Dental and Medical Practitioners Council. And then the Allied Health, the clinical officers and others, they also have the Allied Health Council and very many others. So those different councils regulate the kind of practice that we do. And for one to be able to provide, to be able to be into clinical practice, you must be licensed, you must be registered with those various councils or respective councils according to your profession. So I do not recommend, first of all, those community, I don't know if I can call them practitioners, unless you are a registered person and your council or your regulatory body actually allows that practice. So I condone the kind of works that are done by the quacks, if I can say, whether from the community, whether in the various health facilities, clinics, and very many others. So I would, what I can urge the community to do, in case there are issues related to whether unwanted pregnancies, whether pregnancy that is wanted, whether sexual reproductive health services, let them come to the healthcare providers that are licensed, that are registered. And in case also in the community, they have those so-called quacks, or people that they suspect could be quacks or unprofessional, they should be able to actually can I say, report them to the police or to the people that enforce law and order. I think that's what I would say.
Thank you very much, Musao Lilian. I'm going to get back to Mr. Mutera. Officer, do you think we need a bylaw to deal with traditional birth attendants in Kawempe Division? Do you think as stakeholders we can join hands and come up with a bylaw to reduce the spaces where unsafe abortion is being done?
I think it is not about having a bylaw on traditional birth attendants. I think it is the availability of safer spaces. We all know that our population is bigger than the available health units. So there is congestion. 2, because the available health or safer spaces, they are overwhelmed by numbers. In one or the other, the medical practitioners, because of fatigue, also end up doing mistakes. You have heard those complaints. Abasawo balagajjalidde ku mulimu, omwana wange n'afa. And that one will be hard because the other one is a public facility. Any mistake that is done, it is publicized. So, somebody who is in a remote place where there is no accessibility, and he has heard that Kawempe abasawo tebafaayo obeeyo omwana wa gundi yafiirayo, ambeere wano. That's why people prefer to be in such places. But I think as we move on as a country, certain things are being tried. Service delivery keeps on improving from time to time. So it will automatically phase out. Like the way bicycles phased out. No one chased bicycles. But the availability of motorcycles, the availability of vehicles phased out bicycles. Even, you can even, there are certain places where you won't even see a bicycle. Not because they are not there, but the system is automatic. That once this one is on the increase, there must be a what? There must be a decrease in the other. So, yes, they are unsafe, but we also need to recognize that they have a role they have played. In fact, if you contact people who are above 50, most of them are a product of those unsafe what? Only their challenge is that once situations get complicated, now they panic. But I think in villages where they have VHTs, they have continuously engaged such a they have engaged them to always detect that if this situation is beyond them, they refer when there is time. I think that would be the best. But there are those who are accustomed to them. You will not convince them, say, Zenzala Bulungi, and they are used. On the recommendation, what we can recommend For us as law enforcement, what we are given to enforce is what we enforce. But also, I think as the medical fraternity, they can as well also have that solidarity and they stand on their ground. The most challenge we normally have with them, especially when things don't go well. You know, we are now talking about when abortion is like normal delivery. It is a two-way traffic. Somebody can produce well, the mother and the child are okay. Similarly, abortion, it can be performed and it is successfully done and the bearer is okay. But once things turn the other way around, even in normal deliveries, leave alone abortion, once either the mother or the child things go in the opposite way, then now people come and say, how did it happen? How was it performed? And we are all judging. Even the victim themselves, or the people who bring the victim. So I think once we have legislation and it is clear about that, and those circumstances, those exceptions we gave out, they are clearly stated, I think people will be free. You know that you will go, maybe because you have been raped, and it has been proved that you were raped, then you can go and perform your safe abortion. Maybe you have the medical backing that there is an abnormality with the fetus, then you go and have a safe abortion. But once those grounds have not been established, we are still working behind doors.
Thank you very much,
You're welcome.
Officer. The floor is now open. The floor is now open for all participants of this dialogue or session. Yes, you can come forward.
Thank you so much for the good discussion. I just have a few comments, and from the observation and of the speakers. Unfortunately, I wanted to begin with the representative from the Uganda Kingdom. I loved the fact that they are trying to preserve their virginity, but unfortunately, is that in the current situation, people are having sex. Remember when we are training with Ticket International as abortion service providers, we trained from here in Nansana, and we did a study to find out how many people are doing sex. Our study was, yes, sexual active. Doing it from 13 to 19 years. And we found out, we used 250 something participants, but almost 198 had sex, and not more than once, according to the questionnaires. And the reasons in the down questionnaire was one, adventure, pressure, and those were the main reasons. So let me tell you, due to the social media exposition, and I'm a Generation Z myself, I'm a young person, sex is nowhere to run against it. People are doing it whether you want or don't want. So, in my own opinion, I would still advocate for safe abortion from qualified healthcare providers, of course. Of course, there are dilemmas in that environment. Me personally, as a nurse practitioner, I work with the Dawson Youth Clinics and with Mbara District Record Service. So, another hindrance services to these young people is that the ancient modern service delivery is too bad. Do you know why, Afande? You know, you were saying that people are not going to Kawempe, they are going to Komamboga, because they are young people who are working there. Trust me, if they come, they see somebody looking like 50 years, 60. They don't. We had the challenge at Boni Community Hospital. Our Dowsend Clinic had old people. The attendance reduced. They would take those people for trainings and they come to implement. But people, doesn't just come for the awareness. But coming one-on-one, people would not come. So the report reduced. To the extent even the funders started asking for the whole quarter. Until they changed their, but let's shift now so and so back to OPD. So and so back to OPD. Let me tell you, do you know the people who work in the Dowsend Clinic? Just certificate nurses, young people, right now as we talk, in a quarter, if you are submitting it to the funders, they'll be having over 1,000 people who are attending it. Because of the ancient, people will not visit these government facilities so much if they don't clearly indicate youth-friendly services because they feel it is an ancient modern system. Whereas Lillian was talking about the new that is merging with soft skills training, just like people have seen the new CEO on trend doing a good work. So I also want to talk about decision making. It's very discouraging to see that despite our conversations here, we are not involving young people to decide. Just like the U-Boss has that the most percentage, 22.7% actually percent of the national population, we are young people. That means that we need time. We need also to be involved in decision making, not just sitting there saying, aha, you see, nobody should do this. No. Young people should be brought on board, tell us what they go through in their dormitories, and we take their decision for consideration.
Thank you very much, Speaker. There's a hand behind you.
Thank you so much, Moderator. Dr. Pure Healthcare here. I'm happy to be here. My addition or submission was on stigma. The issue of stigma, I feel, comes down to all of us as individuals. Either you are a parent, or you're a healthcare provider, or you are an uncle, you are an auntie. I believe that all of us in our positions are either judging or misperceiving whatever is going on. The truth is, all of us know. As you start to age, as an adolescent, sex is normal. So we shouldn't be looking at it like it's an abomination. That is one. Two, no child is going to come and tell you that, Mommy, Daddy, I am having sex. No one. So the truth is, we should all be, take this thing very, nicely. Don't judge a 16-year-old asking for a pill. Because they're having sex, and you may not know, but they are having sex. So if you know they are having sex, how are we going to make sure that that sex does not result in what we don't want? That is the pregnancy and later on, the abortion. Thank you so much.
Carol, do you have any recommendation
On
the theme of discussion?
To the regulators, maybe. Eventually it will come with time. I mean, like if you look at, and I want to thank associations like these ones who are already starting on the journey. It's not an easy one, but we'll get there. Like we can look at the people who have already done it. Eventually we'll get there. That abortion can be brought to table. That we can decide on, I can have an abortion if I don't want to carry the child. Thank you.
Thank you. Anybody else that has something to say?
My name is Chikoke Mutebi, and I'm from Makindia. On the topic, one, I want us to appreciate that on the land where we sit or where we stand right now, abortion is a very controversial issue to discuss even. That's number one. One day, the Minister of Education wanted to introduced sexual education in school, I think she faced a backlash over that, and that was scrapped. Why was it scrapped? Morally, we believe that sex is for the adults, right? But in reality, people start having sex as young as 10, 11, 12, 13. They begin having what? Sex. And we all know that once you start testing, you can't return back. So we always appreciate that sex is sweet for all of us.
Yes.
But we don't want the fruits of what?
Sex.
Sex. Then this brings us to what brings stigma in the communities. But in each and every community, when you're young and really have sex and it happens, you get pregnant, you're a burden to your family. As someone was treated earlier, the school, the entire community. What I don't agree, it's a community thing. No, it's done by the practitioner in hiding and the victim. They all do it in what? In hiding. Only get to know when it turns out badly. So it's not a community thing. Because if it was a community thing, we would agree to it as a community, but it's what? It's okay. But the community, even if someone has aborted before, this person will also come and start like pointing the fingers to one who was aborted right now. If they also did it before. So that's how abortion is. I had a question from a police officer who said that one should keep a pregnancy until one impregnated appears or is behind bars. So my question is, someone's raped by someone who doesn't, she doesn't know. The person who was raped is on the run. You're telling me to keep the pregnancy, of which I don't know its roots. Who is supposed to arrest the culprit? I think it is the police. So if the police has not arrested the culprit, why should I keep the pregnancy? Is there a reason why I should keep the pregnancy? Because after all, you're raped, you're terminating someone's life, with someone I don't know his roots. So police, in other words, when it comes to that, they should at least be human and understand that if at all the pregnancy is gotten from someone I don't know, however much it is in good condition, I don't have a reason to keep it, because first of all, I was not interested in getting the pregnancy. Two, I cannot trace for the whereabouts of the offender. I also request for that. Lastly, let me talk about the so-called safe spaces. Actually, the safe spaces themselves are not safe, as we said, according to the attitude of our medical practitioners. So that also makes them not safe at all. Number two, when you look at the population that needs services, in ratio to the funding, they don't really match. You find that the funding is very low. So by the funding being very low, it means that these places are also not safe. So I would urge the government to appreciate that we have a very young, vibrant population which is adventurous and also adventures into sex. So they should put there a bigger budget for sexual reproductive products. They should do that. And also the funders should also look into it, that it is very necessary to increase on the funding for sexual reproductive health rights products. Thank you.
Thank you very much, Speaker. We are having policymakers. Let's give the microphone to Mama Nachobe. We are happy to see you here.
Thank you so much. I thank everyone who has attended this forum. First of all, I'm Nachobe Sylvia. I'm the Executive Secretary of Public Health and Environment, Kaipa Division of Council. Yeah, we've had all the panelists, and me, what I've realized, the truth is abortion has been there, even when we were still in school, and it was unsafe abortion. For example, in my secondary school, there are girls who used to abort. In fact, some of them lost their lives. One of the girls lost her life. She took some tablets and lost her life. Of course, they kept it as a secret. For us, we came to know about it as dorm mates and even the school. But they tried to protect the school. So that means that thing is there, the abortion. True, our cultures don't permit that. For example, in my religion,
Yes.
the Catholic religion,
Yes.
you're not supposed to abort, you're not supposed to use family planning.
Yes.
When you get pregnant, you have to just deliver and multiply the world.
Amen.
That is the what? The law. But there are some scenarios when this child, for example, the student I used to study with, and it was the teachers who were impregnating these girls. Like Sheikh was talking about having a girls' school. We girls have so many challenges. There are so many complications. Some people are complaining about, everyone coming up fighting for a girl child. A girl deserves this. After man impregnates you, then he goes away. So my advice is that we as policymakers, we advocate for some of there are some scenarios where abortion can be what? Can be accepted. And even in the law, it is not accepted. But for example, someone raping, someone impregnating, incest, a relative. Teachers in schools, of course parents will not understand. You go back to your father pregnant, of course he will even kill you. I think we should bring all stakeholders on board. Like the traditional birth attendants. In my area, they are doing this. It even happened last month. Bamulerua, giving those people those local herbs. And children are losing their what? They are losing their lives. Someone aborts, and then that girl doesn't go to the hospital. In the long run, gets some fever, and then dies in the process. I think we've not done enough as stakeholders. Rogers was talking about putting up safe spaces. They're also not safe. They're not safe. I don't know what we can do. As we are having these engagements, we the leaders are lucky that we come and discuss on these platforms. We even meet with different people. But let's go back on ground. That is the thing that I'm crying for. We go back and involve the Nabachala. We call the senior women in schools. We talk to them about this, so that they talk to these young girls calmly. Someone cannot talk to a man like Sheikh is talking about those girls. There are some issues that you cannot talk to your father. You cannot tell your father about. But let's empower these female senior women in schools. We empower them, even the Navachalas in our different areas. Even the Mulera, those traditional birth attendants, we bring them on board. For example, I was happy about what our DMO did, Dr. Isaiah Chebrod, as the certain diseases that had come up. What was that? Was it COVID? And they brought even those traditional what? Those traditional healers in our areas. And they come and discuss. They have issues. We should talk to them about the advantage of having these safe what? Abortions. It's not that I'm supporting this, but these things are there. So if we are to help our people there, let's empower the senior. Let's start from schools. Ababana abawala tuloza tebamanyi. Omwana atuuka mwezi wano ng'alina n'obwongo obukusinga. I'm telling you people. Once a girl has slept, I have a girl there. I was taking her for a scaling program, and she was a cancer nakagala abasajja 12. Those girls are doing it, and she's aborting. She's aborting every pregnancy that is what? It's coming up. She's not even sure whether she will give birth in future. So my advice is, let's empower all those leaders. Let's talk about these things, you people. even our little girls, our young girls, when she gets a problem, let her come to you. You have given birth to boys, only boys, I have 3 of them. My son, I was like, the brother is in P3 and he's in P5, the first born. Then was like, Elijah has a girlfriend. Then I was like, but she's my friend because she loves me. A young boy. Then I was like, anyway, maybe you don't know the other side of me. So I had to start talking to this. You parents, this is very serious. Let's talk to our girls. Let's talk to our boys so that we can save this generation. That is, I beg to submit.
Thank you very much. Still on abortion solidarity, bringing on board all stakeholders to advocate. Let's hear from Mama Naluja.
Neyanziza nnyo era ngenda kukozesa olulimi olw'ettaka kuno kwe tuyimiridde.
Mama tewali buzibu.
Erinnya lyange nze Naluja Hanifa nga wano ndi mu biti bibiri. Ndi chairperson w'abakyala Nansana Division Women Council ate nze ntwala ebyobulamu mu ggombolola Mituba 2 Nabweru mu Bwakabaka bwa Buganda. Ebibuuzo byange ekisookera ddala kigenda kuba ku baami abali wano, bataata mwenna abali wano. Njagala mubeere beerufu. Ani yali afunyeeyo obudde n'atuula n'omwana we ow'obulenzi n'amubulira ati bw'otuuka mu myaka gino ekibadde wanna wano olina okukwata ekirita okweyonja? Bataata, shaving a boy to know how to shave. Ani yali afunye obudde? That had been a role of a father on a boy child. Gye badduka ne batulekeranga baani? Bamaama. Era omwana omulenzi bw'akola omusango, maama we yamanyi. Akulekera omwana ow'obuwala n'akulekera n'ow'obuki? N'ow'obulenzi. Ne weesanga ng'ow'obulenzi alina w'atuuka nga mu mazima taata ejo eyo yagibeeramu, yamanya ne bye yalina okukola. Nga kitegeeza alina okutuula naki n'omwana ayogereko naye. Kati okuleeta ba stakeholders ku board ngamba kyekiseera tugatte obwongo, tugatte amaanyi, tusitule eddoboozi eryawamu, tulabe nga tutaasa generation. Bwe kitaba ekyo tugenda kuleka omuwawa. Buganda oba Uganda ezzeeyo ku muki? Ku muwawa. Sheikh nkola sessions self-driven mu masomero. Naye head teacher w'essomero yaŋŋamba, Hanifa, temukola mu secondary mwokka. Abaana bagenda okuva mu primary nga they are sexually active. Agenda okutuuka mu secondary nga she knows how to pairing. Kati gwe bw'otunuulira ali mu secondary musewo wa Mbogo, yagenda okuva mu primary P7 nga amanyi ekyokukola ki? Ekyokukola n'engeri gy'akizannyamu. Kati eno effort egenda okugatta ffenna. Naye obuzibu we buli mateeka. Sexual reproductive health waliwo yagirako tugitwalako mu masomero ne bagibaaninga. Tetulina abazadde bennyini tuyigiriza abaana baabwe obuki? Obuseegu bennyini. Olwaleero bwe bali mu kkuba enduulu eggwanga bwe likoze eki? Kati fe abaana tetuli bazadde, tetwali bamu ku abo abaakuba enduulu. Ekibuuzo kyange kigenda eri Sheikh Musebo, ettica wa Muzit wa Mbogo. Kinsanyusiza nti ova mu ddiini gye nsoma. Nfubyeko nnyo okugenda mu mizikiti nadduka ne ku ttwale. Bampa obukulembeze ku ttwale ne mbuddukamu. Lwaki? Bampa kyabyabulamu.
naye nga tebanzikiriza kusomesa health dakiika ziwera 5 nga bwenjogedde kati nga bampa eddakiika emu okoonako katono ne bawa Wahabu nayogerera essaawa mmeka ne bwe guba muzikiti ne bwe tuba tukuŋŋaanye nga waliwo busiraamu we bukuŋŋaanye munnange Wahabu bamuwa obudde bungi. Simanyi Wahabu wayogerera ku parenting, simanyi Wahabu wayogerera ku early childhood development, simanyi Wahabu wayogerera ku abortion or sexual reproductive health. Naye ekyo kiri nnyo mu busiraamu gye nkiwulidde gye bawera Wahabu obuki obudde. Nagendako mu bakatoliki bangobya topiki ya family planning bubi nnyo era saagiyingiza. Kati sebo sheikh ne muganda wange Nakyobe eddiini zino ebbiri ze zisinzeemu obuzibu gyenvamu ey'obusiraamu n'ey'obukatoliki. Tebyagala family planning aye tebyagala kujjamu nki bw'osanga nga n'okuweerera kwaffe abaana bava mu gundi ezo zetwogeddeko be basinze obuki kuba tuzaala bangi endabirira n'ekola ki gye biggwera nga bagenze ku street bafuuse kitakola ki kubanga parental guidance yakola ki yabula. Kino kigenda eri mukulu wa poliisi, mwami wa poliisi wagambye akujjamu olubuto nga kuli mu mateeka. Omwami wange yanfunyisizza olubuto mbadde twesunga okuzaala omwana naye bwe batumenye mu lubigi ne tusigala homeless twakanyiza olubuto luno tuluggyemu tugira tulebera nabali abana etteeka lyera ligenda tukwata neyanziza.
Thank you very much Mama Nalujja. Mbadde nsaba omuzindalo tuguwe Officer Child Protection Unit atuddiremu ebibuuzo bya afande.
Madam Moderator, nga afande Sero bwe yagambye nti abortion tekkirizibwa mu mateeka naye under such circumstances a few of them zayogeddeko like okusevinga obulamu bwa maama awo kikkirizibwa ate na kikkirizibwa nga ani akikoze era okikoleddewa ate nga mu biseera ebisinga tukuze nga tumanyi nti abortion tekikkirizibwa mu society yaffe. So under law bw'oba okikoze nga toli legal licensed health worker kirina penalty yakyo. The penalty eyinza kuba 14 years. Then a person, 14 years imprisonment. Then a person who aids, like okitegeddeko oba gwe mwennyini odusiza omwana omutute eyo gye bagambye eyo in Kwash Health clinics bwe bakusiba myaka 3. Then okudda ku kya madamu oyo kyabuuziza really olubuto olwo malufuna nga mulwagala people who are above 18 mwami na mukyala kyemugendamu muba mukitegeera muba muplaningidde omwana. Ndabye nnyo abantu nnyo mu street mu bwayise muno abalalu abatalina we babeera nga balina abaana baabwe ku street. Ffe nga child protection waliwo we tujja ne tugamba omuntu ono katumugyeko omwana tufune we tumuteeka because we have those homes where you can keep those children. Naye nga takkiriza agamba oba nsula mu mwana nja kusula na mwana wange. Kati eyo excuse gy'oleese nze njirabye ngaalem excuse tesobola kugisamu lubuto era bw'oligyamu etteeka liba ligenda kukwata.
Thank you very much Mama. We have one of the abortion survivors that I would love to give us her story, how it happened and what exactly were the scenarios surrounding it.
Come on, give me and put that. Record that, it's important.
Gyebaleko banyabo ne bassebo. Amanya gange nze Hawa. Ndi abortion survivor. Ntya. Nfuna olubuto. Bwe nalufuna nengenda mu antinento gye twayijje nalimirira eddagala lyange. Olubuto lwange olwatuuka emyezi 7 nefuna obuzibu nga bleedinga wansi. Nenziruka neŋŋamba ka kino kinene kanziruke wa ku ddwaliro gye mmirira eddagala lyange. Bwe nagenda abasawo ne baŋŋamba bati tugenda kurifaaringa wa ku rifaaro e Kawempe. Bwe natuuka e Kawempe ne tugenda mu scan. Bwe nagenda mu scan basawo baŋŋamba bwe bati omwana ali aweza emyezi 7. Omwana alina kidney problem. Tojja kukola ki ate naawe olina damage ku kidney. Tojja kusobola kukola ki kuzaala. Kye tulina okukola okuseevinga tukoleko bibiri oba kimu. Okukkiriza tukujjanjaba oggyemu olubuto omwana aveemu oba okusita. Nenjogera ne bba wange ne bamunnyonnyola obuzibu obwo bwe nalina. Bba wange nakkiriza ne tutuula ku mmeeza abasawo ne banzijanjaba. Naye ate wano e Kawempe kyabalemererwa ne bandifaaringa e Mulago gye nagenda gye bankolerako treatment k'okusurvivinga.
Thank you very much. She got a complication.
Did you abort or
It was induced. It was induced. Yes, Carol, do you have something to say?
I wanted to comment on that. 7 months and above is not abortion. 7 months and above. We are not abortion.
28 weeks plus is the delivery.
Abortion is below
28
weeks.
Okay. Thank you very much for that. Let me have recommendations from Shay, and then we are going to close this session with Sao Lilian.
Thank you. Just to clarify, in the cases where Islam permits to abort, that should be not exceeding 120 days. In the cases where Islam permits, the fetus must not be exceeding 120 days. Those are 3 months. Because in the nature of the creation, therefore, nature of the creation, for us the Quran tells us the creation occurs just from the sperms, the semens. Then after a month, after 40 days, it now becomes a clot of blood. Then after 40 days, now a flesh. That's how that the child evolves. The Quran clearly indicates that. So after beyond 120 days, Islam doesn't permit, unless there are health complications. So my conclusion is, abortion is forbidden and it's an abomination. But accessing health services, post-abortion care, is paramount and is a right for everyone, regardless of the age, regardless of the nature, regardless of the tribe. It is a right for these young ones. Safe abortion. Safe abortion. We advocate for it. In cases where there are complications, we advocate for it. Different Muslim scholars, we have schools of laws in Islam. All the scholars of Islam, they reach the extent of permitting it. But initially, when you look at the gist part of it, when you abort, you are killing. and killing is not allowed. So we should advocate for safe. That means safe zones should be created in cases where we need to do it. Thank you very much.
Thank you very much, Shay.
Just the Mami, your concern. I think we need to do some sensitization. Not only in students or children or young ages, but even with the elders. We need to do some sensitization, especially the leaders. Leaders have to get to know that there are things that now we have to teach the generation. To tell you, I'm one of the sheikhs who tell people that contraceptives are allowed in Islam. Family planning. It is allowed with some conditions. Just because we are not on family planning, we are on abortion. Leaders, church, mosque, all leaders at all levels, they must know that where we are, there are things that we have to come on board and teach the generation. Otherwise, people outside there are agreeing about the things. People agree. So it is a task. I don't know how we are going to handle it, because most of them are our superiors, and even they had to be reached and accessed. But we shall look for ways of engaging them and talking to them, so that some of the things are given priority. You've complained of herbal medicine practitioners being given more time than you, the health workers, which is not good. If it has to be even. Let the herbal come, let the health worker come. Thank you very much. We shall look for ways of how we can harmonize with it.
Abortion solidarity, advocating for safe abortion spaces, and safe park. Let's hear from Musawa Lilian.
Okay, thank you very much, Madam Moderator, all the speakers, and our audience. Thank you very much for those submissions. So this time around, I'm not just going to speak as a midwife, but I'm going to speak as an advocate now of sexual reproductive health, of safe abortion, without fear or favor. So now, looking at the death of mothers, and allow me to use the simplest language, what we call maternal mortality, mothers dying due to pregnancy-related complications. And especially when we look at the teenage pregnancies or the young girls getting pregnant and dying due to unsafe abortions. Because when you are looking at some of the causes that are leading our mothers to die, especially the young girls, are the unsafe abortions. And that is something that is very out there and open. And it is very clear. We are still seeing the young girls die due to unsafe abortions. And as a midwife and as an advocate, it is not something that I can take for granted. It is not something that I actually can take lightly. And also as a parent, it is not something that you can take lightly, seeing your young daughter die while due to pregnancy-related complications or due to unsafe abortions. So what am I suggesting in terms of recommendations? I am looking at it from a comprehensive approach. And I'm going to try to use the simplest language, but I'm looking at these recommendations using what we call multi-sectoral approach. It is not one way of doing things. So for example, I'm going to start from the top to the bottom. The government of Uganda, through the Ministry of Health, has a very big role to play. The Ministry of Health, Ministry of Gender, and also Ministry of Education and Sports. As you are aware, and one of you said, that previously there was an adolescent health policy, there was school health policy that was coming up. But when it was being tabled to the parliament, everyone bashed it. There was sexuality education policy, comprehensive sexuality education policy. They fought it very hard. They said, you're going to teach our children how to do sex. But when you look at the policy, it is totally different. It has what we call age-appropriate sexuality health education. That if you have a daughter, for example, of 2, 3, 4, 5 years, What kind of information are you going to give them? Maybe you're going to tell them, you're a girl, you're a boy. Those who are 4, 5, 6 years, maybe you're going to say, don't touch here, don't touch here, don't touch here. Those who are 8, 9, 10, maybe you're going to tell them, you see now, you're going into puberty, now you as a girl, you're going to have breasts, you're going to have, pubic hair, you're going to have hips, you're going to have a soft voice, you're going to have your periods coming. And this is what it means when you start having your periods. Once you have sex, these are the consequences. Same with the boys. That's what the policy talks about, and talks about such kind of things. But because it was tabled and it had the what we call sexuality education, everyone thought it is teaching about children, sex, and it was rejected. But I think it is something that is very important. Within that, it has, for example, if you're going to prevent teenage pregnancy, what are you going to do? Maybe you need to use this kind of protection, whether it's family planning methods or these, different services. You need to be able to access them. But unfortunately, this policy was not accepted. So my recommendation is that the government of Uganda, through also to the Parliament of Uganda, also through the Ministry of Health, Ministry of Gender, Ministry of Education, there is a need to push for that policy so that actually the young people can be able to access these services. Secondly, apart from the national level, now let's come to the district health officials or the district teams and the politicians, whether LC1, LC3, LC5, all those kind of stakeholders. These people have a very big role to play. And once they are able to accept that actually young people can be able to access these kind of services, whether family planning services, then we shall be able to prevent these kind of abortions we are talking about, the unsafe abortions. Because we know that if you're able to use these services, you'll not be able to get pregnant. You protect yourself. And we shall not be talking about abortion as we are. So on top of that, apart from those stakeholders, we need to also engage the cultural and religious leaders. These are big stakeholders. Our people, the community outside there, these are the people that they listen to. They trust them, they believe in them, what they say is what is taken. So we need to be able to actually engage more of these cultural and spiritual and, and the religious leaders. They have a big role to play in terms of sensitization about, youth-friendly services or sexual reproductive health-related services. Then let me go back to the community. And the good thing, the panel that was here, or that is still here, did a good role when it came to the community aspect. With the community is not the people there. We are the community as we are here. Whether parents, whether relatives, whether neighbors, and all these people. We are the people that are in the community, and we are the community. We have a big role to play. And I said that charity starts from home or begins at home. As parents, we have a big role to play. As parents, we have a big role to play. And I'm going to say it the third time. As parents, we have a big role to play. Charity starts or begins from home. What are we doing as parents? What are we teaching our girl or boy child? What are we teaching them? So we still have a very big role to play. Institutions like schools and health facilities also have a big role to play. So I believe that the recommendations are from that multi-sectoral approach or the multidisciplinary approach, and each one of us has a big role to play. Thank you very much.
Thank you very much, Musao Lilian. Still on abortion solidarity, I have a stakeholder from Nansana, that is Dr. Kaliro. Please say a word.
Thank you, moderator. Good afternoon, ladies and gentlemen. I'm Joshua from Nansana Municipal Council, and I'm representing the municipal health officer. With us as Nansana, when we thank HolyNet for organizing such an engagement. These are learning platforms of what can be done, what is possible, because these issues are quite pertinent. Abortions are there, and day in, day out, we are trying to know what can be done. One, can we reduce them? Yes, what are our cultural leaders saying? They've said it. What are our religious leaders say they've said it, and what is the law saying, and they are saying it. But there are some pertinent issues that I haven't heard, and some I'm going to add on. Members, ladies and gentlemen, we don't need to hide our heads in the sand. Do you know that there are people whose livelihood is dependent on sex?
That is true.
And their biggest number that lives in this Nansana, Kawempe, it is the biggest what? Number. Their livelihood is dependent on that. Yes, we've talked about the schools, yes. We've talked about the other whatever, yes. But this person comes and tells the service provider like her, madam, kalimu, because it is her livelihood. So, the abortion thing, it has a yes and it has a what? A no. But back to us, the service providers, what are we saying? At least at that table, if he happens to meet a professional, what are we saying? Why doesn't this person go with a long-acting family planning service? So that we don't, because it is also a danger. We not jam olwalero, not jam olwencha. It is a big what? Challenge. It is an issue that we need to tackle. Let's have people come to the professionals. They will be guided. Let's give them a family planning what? Service. On the other case, where I need to add some meat on is the issue of us, the trouble causers, the men. I think Coordinate could organize a bigger platform for men. Because, yes, the men who are here should be the converted, maybe the converted. But we need to have a bigger platform for men. Actually, in the provision of health services, we are really getting challenged by us, the men. Bebatagala gemesa bana, bebatagala kumira dagala. We have the issue of HIV and AIDS. You tell these guys, please. Bwagamba omukyalo okwekebeza kasita kuba mulamu nze nange mba mulamu. Is it true? No. It is not. And the issue that they are talking about, the abortion case, it is coming out of sex, which means HIV is on the rise in our communities. But people, we are just saying that these things, so we need to do several engagements, and we will call upon Coordinate to try and get us, these men, down in the communities. If we could look at, because we are having some studies that is happening in Nansana by PSI of how men can be engaged. Their model, they are finding us where we work and getting some people that can be peers to talk to us about such issues, abortion, family planning, health services seeking, and others. And we are finding some good champions. Kutuba tuliba boda, tubeyo no wa boda, ngako, ayogera naffe. Kutuba tuliba bakutukuba mayinja, tubeyemu no waffe. So that is a model that we would wish our IPs to help us try out, to see out us how we can reach out to the men. Himself from, we've copied some space from Bwana Wandera, targeted activities, SR activities for the youth. Na yetu gamba tutia, bani abatuyambako, Sheikh, bwaba tuyise, okujja okusoma ku madrasa. Can you give us chance? Otukubireka akasimu, tibanange nayise abavubuka baki bangi. we come and pitch camp there. Now we mirire ku nkondo okyogere. Kyaba nange twazze ku kino ne mulina okugenda wa wali. We decide from such a person. Results will be up. Kubanga yes, kituufu eno saidi yaffe y'abazadde mukyogedde wayogedde musimanyi bw'obuuka mu kisenge sheeke ewuwo bwegye ekiri. Ffe ennyumba yaffe ruumu eno n'obuteeka n'eno. It is the bedroom, it is the sitting room, it is the dining, and so on. Sheeke oyinza okuba olina omukisa naye ffe wano bwe tubeera mu kawempe nansana. This is the room, even smaller than, and it is housing more than a family of 5. And people learning from by doing. So these are issues that really are a big challenge that we need to. This engagement like this is really quite pertinent. And the issue of the law, yes, the laws can be there, and the laws are there. Zijagala okubabuulirako takibagambye owa child protection. The busiest office at newali ewaffe ku municipal office ya probation twaddira akasonda ne tukateeka eri mu nsonda abeera eyo n'abantu be. Abantu balina ebizibu by'abaana. They have very big problems, and the problem is the man olujja onotampa fees onotampa college. That's why we are saying yes, eddiini tetukkiriza kukozesa family planning. I like Sheikh said is one ayimiridde yekka kuba bagamba if you are saying the truth you stand alone because akirese muki mu courts. Yes, eddiini yes, but family planning is a way to go. Tetukyalina kyakikolera because one thing edda what I would tell you when I just began working in the health system, members, sicknesses were taking children. Measles ngajja n'ayusa. Ani yagendako ku acute? Was ever been to acute? Bayinza okufa. Kano ne kafa. It is no longer possible. Era kati ne maternal death n'afiira mu ddwaliro lyo. You have to answer questions afudde atya currently. Tetukyakikiriza. You need to explain why a mother has died at your point of care. So, systems have somehow risen. Vaccinations are there. Tetukyetaaga muntu kutufaako mbu teyagemeddwa. So, the issue is we can have the children that we can have at the right time. Eh? So, in one way or the other, if it is inevitable, yes, abortion can be done. Aranga fekwa service provision, but kyogedde abasawo. Ffe tulaba mulwadde. We see a patient. Era bw'ayingira mu clinic yaffe, we are seeing a patient. Many of these things happen outside. Kati ekizibu bakyogeddeko digital, the digital era. Saawa eno ne bw'okwata essimu yeeyo n'ogenda ku Google no panchingamu eddagala erijjamu olubuto, it is going to come there. Kati n'abaana baffe tetukyalina kyetukola kyetukweka. Yes, essimu ogimuwadde naye olina okumugamba kino kyenkugamba nga muzaddewo. Ebintu kwebiri biki bingi, but we need to be conscious. Ojja kubirabako naye obudde tebunakola ki tebunakutuukira kubikozesa. So as Nansana Municipal Council, we really appreciate the services of Coordinate and its activities, and we are asking for more. Mutuyambeko okutuuka ku bantu abo wansi, because certain times batuuka balaba kaliro eva yayogera. So we need other babalaba nalujjaka naye she has also become too monotonous. The other thing that we are having, he brought out the issue of the age. The VHT system is a strong system wansi eri kutuyamba. Tubayita bajasi baffe ab'okuki ab'okuttaka. but the challenge is real. He has talked about. These bavubuka are saying, the age, Narujja Yangema, Ganchari Muto, is the same Narujja speaking on the same things. So, it is another thing that we need to help us identify. Katolaba kati bagambye we are moving digital. Narujja ayinza okuba asobola. Naye essimu eriyo ba VHT baffe betuli kuwa amasimu n'omusaasira. They can't use them. So, yet we are not getting other peers that can. So, the input y'abantu abasobola okwogera nabo nayo it is an issue. If Cohorinet can help us try to find abaana abali ku mulembe guno ogwa digital that are ready to do mukolera ki? Muterakolera ki? Obwannakyewa. The voluntary. These ones I always tell them. You brought yourself here. For me, nze balina okunsasula and they pay me heavily. Government esasula very heavily. Nsijja kukikweka because batugamba we n'abasawo baabongeza omusaala. Yes. Naye kati twetaaga okulaba nti tulina bali batukole ki batuyambeko. The issue of the attitude. It is real. I wanted to give a scenario. Now we have a center up there. Coordinate guys know what happens there. We have a small maternity and a small facility. On a clinic day, you come there and wonder. Era ne bwembanga nzize nga nina ekizibu ntambula butambuzi n'enkola ki. Nenvaawo. The stigma can be real. The numbers are too much. In a day, and actually even the service providers are few. Obasaasira. Either midwife omu ali ku night, omulala ali ku day. Owadde azaalisa abakyala abasukka 10 per day. No one night, that is the same thing. Kati sometimes mutunenya naye mubanenyeemuko ki akatono. These guys are overwhelmed. Naye nga alina okusavinga baki abantu. Eyo facility wotunira wali maternity. Leo omukyala ngo olinamu kasente ogamba nedda. And we are trying to fight to fight tugaziyawo okwo. Wagaziwemu okwo. N'okulaba nga we see to it that as government we are advocating bongereko ku baki kuba service providers. Because that center has to run with a total number like of 8 midwives. Nebali wo basatu. Naye nga bazaalisa abakyala basukka. The Kawempe he is talking about, the people who have gone there. Actually, batuuka ne bakubako n'enduulu. Why are we referring n'abakyala twandibadde tukola ki? Handling. Kati omukyala okumugamba nti kati alina okugenda e Kawempe. Alina okubaako reasons ki? Eziwerako. She told us these people have been trained. Yes, they are trained in all whatever is needed to ensure services are properly put out. Our call is to you continue giving us these platforms. Abantu bangi balinga abamanyi naye tebakola ki? Tebamanyi. Bringing a police officer of that level to an engagement is quite big. N'abuulira abantu amateeka bannange ekola ki? Gyegali. And we shall continue participating. Thank you very much.
Thank you very much, Doctor. This discussion has been sponsored by Coherinet in conjunction with SAF. And we are delighted to have all stakeholders, dignitaries. We are delighted to have you all. Thank you for being part of this, participating in the abortion solidarity theme. And in regard to what is going around, we as stakeholders, if you could join hands, everybody plays a role when it comes to abortion solidarity. Thank you. Thank you very much. God bless you all.